Hi! This is Dr. Gaile Robredo-Vitas. Our video for today is on understanding newborn baby skin. This is especially dedicated to new moms out there who are super worried about taking care of their newborn babies, and this video aims to serve as a guide, and I hope to answer some of the more pressing questions that you have regarding your newborn baby skin. In this video, I will cover the following: a brief review of the skin's anatomy, unique characteristics that newborn or infant skin have versus that of an adult, how to take care of our baby skin in relation to its unique characteristics, what type of products can they use and what to look for when buying products, and finally, basic skincare guidelines for newborn babies. Now let's talk about skin. If you've been watching my previous videos, I always talk about the skin as having three major layers. So we have the epidermis, the dermis, and the subcutaneous layer or the hypodermis. Now, in this topic, we're gonna zoom in on the epidermis, specifically the topmost layer, which is the stratum corneum. The stratum corneum is very important in maintaining our skin barrier integrity and function. It prevents the entry of harmful chemicals and pathogens in our body. It is also responsible for thermoregulation, for gas exchange, and maintenance of our skin hydration. Some of you may be wondering why when we go to the department store, we go to baby stores, there are products that are specifically made for babies. And I hope that after I discuss with you the unique characteristics that newborn skin possesses, you will understand the importance of why separate products should be used on your baby and on you and your older children. Your newborn baby skin, especially in the first few weeks of life, greatly differs from your skin and even the skin of your older children. Your full-term baby, when born, has an intact and competent stratum corneum. However, it is continuously evolving, maturing, and developing in the first few years of life. Newborn baby's epidermis is 20 to 30% thinner than that of an adult. In babies, yung pagpalit ng balat nila is a lot faster than adults, and this is because the cell surface area is 20% smaller. Baby skin has higher water content and is able to absorb more water than adult skin. However, yung tinatawag natin na natural moisturizing factors, which bind and hold water inside, are lower in baby skin. That's why they tend to lose water faster. Your baby skin will have less lipids that protect the stratum corneum, and they will also have less fat or subcutaneous tissue. And finally, babies also have immature and not yet fully functioning melanocytes, which, in addition to having thin skin, make them more prone to UV damage from the sun. And because of all these characteristics and the immaturity of our baby skin, they are more prone to conditions such as occlusion and friction. For example, in the diaper area, pag matagal na babad, it can cause irritation and rashes, or for example, nadikitan ng tape or adhesive ng diaper yung balat ng baby natin, it can easily be injured. Apart from our baby's unique skin characteristics, meron pang iba na dapat natin i-consider, especially if you're thinking of applying creams or lotion or whatever on your baby's skin. Newborns have a higher skin surface area, which is about 3 times that of an adult. Meaning, pag may nilagay ka sa balat ng baby mo, mas madali siya ma-absorb at mas konti yung pupuntahan niya kasi maliit lang sila. Newborns also have immature drug metabolism systems. Hindi pa ganun ka-efficient yung drug delivery nila and drug detoxification. And like I mentioned earlier, they have decreased subcutaneous fat, which contains a lot of saturated oils, which is more prone to freezing. So, with this, you have to avoid exposing your children to extremes of temperature. And it is because of these reasons that we always advise parents and caregivers to only apply essential products on your newborn skin, especially in the first few weeks of life. Now, how do we properly take care of our newborn baby skin? Skin cleansing and maintenance of the skin barrier through applying emollients are two of the more important things to keep our baby skin healthy. Proper cleansing is essential because it keeps our skin free from unwanted substances like dirt, sebum oil, and also potential irritants like saliva, urine, etc. Prolonged exposure to these, especially in sensitive areas like the diaper region, can later on lead to discomfort, irritation, and even infections. Bathing and cleansing, when done incorrectly, can actually provide an opportunity to damage our baby's skin. And until recently, wala naman formal guidelines, especially to new mommies, on how to properly do this. But the consensus is to use a mild cleanser, minimize rubbing your baby's skin with washcloth, especially in the first 4 weeks, shorten duration of the bath, usually less than 10 minutes, use warm water, and bathing your babies 2 to 3 times a week or every other day is enough. And when it comes to emollients, if you remember earlier, I mentioned that baby skin is not able to hold on to water and moisture that efficiently, and as such, they are prone to dryness. Applying emollients that are specially made for babies reduces this water loss, keeps the skin hydrated without disrupting the skin's pH and sebum production. Now, how do you choose the right products for your babies? First, let's discuss what a mild cleanser is all about. Your baby's cleanser should be able to effectively remove dirt, sebum, urine, etc. with minimal effort, but at the same time mild enough to keep your baby's skin barrier intact. Harsh cleansers can disrupt your baby's natural skin barrier and allow penetration of unwanted substances and even microbes. Water alone cannot remove oil, dirt, and sebum, and pwede rin siyang magkaroon ng drying effect on your baby's skin. I personally prefer liquid formulations because usually they contain mild surfactants as well as emollients. Choose a pH neutral or mildly acidic form with few ingredients and fragrance-free. Now, when it comes to choosing emollients, I personally prefer cream-based formulations. What's important is that you choose products that are hypoallergenic with very few ingredients and that are fragrance-free. Choosing the right emollient for your baby's skin helps protect and preserve it by limiting water loss and supplying it with the much-needed lipids. And to wrap it up, I would just like to add additional pointers in taking care of your baby's skin. Very, very important, and I always tell my mommy patients this, because of your baby's increased absorption capabilities, only essential things should be applied on your baby's skin, and topical agents should only be applied if systemic administration does not have any toxicity. Halimbawa, salicylic acid is a no-no on baby skin. Second, because of the immaturity of your baby's melanocytes and thin skin, it is strongly recommended that you avoid exposing your babies for long hours under the sun in between 9 a.m. to 3 p.m. and to use protective clothing instead of sunscreens. Sunscreens are not recommended for use in babies 6 months and under because they haven't been tested in this age group. For babies 6 months and older, I would recommend that you opt for physical sunscreens like your zinc oxide and your titanium dioxide because these ingredients are less irritating on your baby's skin. And lastly, try giving your babies a massage. It's actually a good way of conveying your love and affection, and according to research, touch actually boosts immunity and helps fight disease. It is also said that babies who are massaged often tend to be calmer, more secure, hence, they sleep better and they cry less. So that ends my video. I hope you're able to learn from it. If you enjoyed my video and if you appreciated it, please don't forget to click the subscribe and the like button. I will continue to make informative and helpful videos like this in the future. Bye!